Dear doctors, I have a large family, and when one person gets a cold, we all get it. How do I keep from spreading it, and what are the best ways to treat it? You're in luck because we have answers. And if it's spreading to everyone in the family, you're making some mistakes.
Yeah, absolutely. Well, one thing you're seeing, and it's not going to treat a cold, but it may help prevent a cold, is garlic. It contains an active ingredient called allicin, which actually helps to decrease the enzymes that are involved in bacterial and viral infections. So that's how it may help to prevent infections, as well as it boosts your body's defense system by increasing those white blood cells, which also help to go and fight infections.
And when you make a meal with garlic, usually it's loaded with other veggies, and you're sauteing all this good stuff together. So I think it's usually the things you eat with garlic. You don't tend to eat candy with garlic. You know what I mean?
Right.
Yeah.
And you know, you're making that
behavior,
great chicken rice soup. When you have a cold, throw a little garlic in there. It's great. But
Who's
let's backtrack for 1 second here. I mean, what is the common cold?
Well, but if you don't like garlic,
Find
the
a
other
small
thing
one.
you can do. Oh my God, you're actually gonna eat that.
He's trying to. He's next to a sick
Look
nose over
I'm
there.
gonna
He
catch a
needs
cold if I don't.
I know.
You just
well,
eat
if
it?
you don't want to eat the garlic, yes, you just eat it. And it's better raw. They say some of the properties are decreased if you actually cook it. But if you don't want to eat... Oh my God! Smell that over here.
You have that fish odor syndrome.
Wow, man. Yeah, nobody's
that is
gonna
some
catch a cold from
strong
you.
stuff.
Do you have to swallow it?
Yes.
Yes. It's in your system.
Ugh.
But really, you can wash your hands. Make sure
Yes,
you wash
but-
your hands and don't touch your eyes or your nose. And then, you know.
But just quickly, what is the common cold? It's a viral upper respiratory tract infection, typically seen more in the fall and the winter, but you can get that nuisance summer cold as well. What happens after 2 to 3 days of exposure? You're going to develop the symptoms that we all know so well. Nasal stuffiness, runny nose, sneezing, sore throat. You may develop a cough.
But similar mechanisms can prevent you from catching it. And the other big thing, other than washing your hands, is if you're the one with the cold or the flu, you need to avoid touching commonplace objects, because all it takes is you touching the faucet, for instance, with boogers and all the other crap on it. And then the next person comes, hits the faucet, then they put their contact in, they're going to get sick. So part of it's on you. Obviously with kids, they don't know any better. But it's those common areas, the remote control, you got to keep those clean as well.
Yeah, and you know, if you do have cold virus on your hands, if you don't touch your face, you're probably not going to catch it. So keep your hands away from your face. But you know, if you have a cold, how to know if you're getting better or if it's getting worse, time to go see the doctor, look at your boogers. So we're going to talk about decoding your boogers right here. All right, so this is my giant nose, and suppose something like this, blow your nose, all right? Suppose something like this came out. Now, a lot of people think that color is actually from bacteria, but it's not. The color actually comes from the body's own immune system sending white blood cells, which have a green enzyme in there, and that kind of that's what turns the mucus yellowish green. Now, whether it's a cold or a bacterial sinus infection, with both of those, you can have this color, but it's more the time. If this color lasts longer than about 5 days or even up to 10 days, then you're starting to think sinus infection and not just a cold. But if after maybe 5 to 7 days, you start getting this, more of a clear. Now, this is a little darker than clear.
Funky.
This is, but you know, if it was truly clear, you wouldn't see it. But you know, if it's clear after about 5 or 7 days, then you're in the clear.
You're making me cry.
Is it my breath? My garlic breath? All right. What if something like this came out? More of a reddish tinged mucus, kind of thick stuff. Now, especially during the winter time, you know, you got the heater on, the air's dry, inside your nostrils are getting it's getting dried out in there, irritated fingers are crawling up in there. You're gonna get the blood-tinged mucus, all right? Now, if it just happens occasionally, not a big deal.
I want to hear another nose blow. Is there one more?
No, unfortunately, at least you gotta. Now, if it just happens occasionally, not a big deal. But if it's happening regularly, you might want to see the doctor. You might have a broken blood vessel in there.
Hey, one thing you can do, getting back to that blood tinge one, if you're really dry up there, using the neti pot.
Oh, yeah.
Neti pot
Can be really
noise.
helpful to clear out the sinuses.
Humidifier.
Yeah.
Humidifier is a great call.